now return to Mark Willis and Road Dog Trucking News on SiriusXM's Road Dog Trucking Radio.
You know, drivers, you think about every time you fly, you've seen people that are outside of the plane and they're putting bags on conveyor belts, you know, leading up to the belly of the aircraft, and they're doing a lot of stuff, working really hard, and that can be a very, very strenuous job, to say the very least. And many of you that are in the trucking side of this, when you're working flatbed, for example, you're working outside, you're throwing the tarps, it's a physically demanding job, both of those. And it makes you wonder about, okay, how is somebody going to be able to withstand all of that pressure? What does that do to their body, that physical exertion? What does that do to their blood pressure, to their hearts, being able to pump the blood to stay up with a job? And Dr. Fahmi Farah is on with us, one of North America's leading cardiologists, very, very recognizable name in the industry. And Dr. Farah, it's nice to have you back on radio. Welcome.
Thanks for having me. It's great to be back.
Absolutely. Thank you very much. And a little background, like we always do, about you.
I am an invasive cardiologist. I'm the founder and CEO of Bentley Heart Medical Center and the director of Global Health Lines Foundation.
Okay, very good. Thank you very much for doing all of this. And, you know, this kind of makes me think of the fact that when you are watching somebody doing a physically demanding job, say you are taking a flight and you're looking out the window and the baggage handlers are moving the bags up the conveyor belt, it is strenuous, strenuous work. And trucking, like here, many drivers will get out and they'll throw tarps, they'll strap down loads and things like that. And it does take, I would think, a toll on the body, because eventually, doesn't the body start to maybe react to that physical exertion? Does it maybe create problems with blood pressure, or maybe make the heart work even harder to achieve those goals?
You know, physical exertion is actually not a bad thing for the heart, especially for those who are fit and have been doing this for some time. They can tolerate it. But if it's really, like, you know, strenuous and somebody who is not workload, then they could get into trouble, because that kind of workload does temporarily like increase your blood pressure, your heart rate. Versus somebody who's not as fit and who has risk factors, my suggestion would be that they do get a heart checkup first before they subject themselves to something like that.
Okay, very good. And some of these jobs, people are going to be moving 100-pound items, maybe 200 pounds, maybe one individual, maybe a couple people that will do that. And when there's strenuous physical activity that goes on in order to maybe try to alleviate any heart issues that might develop, is it a good idea maybe for people to work in teams to help alleviate some of that stress?
Oh, absolutely. Especially when you mention, like, the heavy load that they're having to lift, especially, like, you know, up to 200 pounds. It's not just a strain on the heart itself. It's also something that can, like, injure their back and stuff, for example. So, yes, I would think that working in teams and taking up some of that load would be a better option.
Okay, very good. And you mentioned, my aching back pain, which I think everybody can probably attest to, having it at one point or another in the course of their life. If the pain is that intense, say with maybe a lower back injury, say a truck driver picks something up, doesn't use the knees to help pick it up, throws the back out, and they start to feel this debilitating pain, does that make the heart work even harder when somebody's in pain?
Yeah, like the back injury, and when they start feeling that pain, it could go on their whole body. For instance, when we're in pain, it has an impact on our blood pressure. Our blood pressure naturally goes up. Our heart rate goes up. And, you know, high blood pressure is one of the biggest risk factors for heart disease. So, yes, it can indirectly impact the heart in that way.
Okay, and so would you recommend maybe more education, say from those in executive office suites down to those that work, I'm using air quotes, maybe the factory shop floor, trucking as an example, to educate people as to the best way to do the job, like maybe lifting with the knees as an example? How important is that, educational?
I think that education is very important, proper training on how to weight such heavy loads just so they don't injure their backs, their knees, and just for their safety overall in the long run for their health.
Okay, very good. And do you find that more and more companies are coming to the realization that if there's maybe strenuous work on the job, or maybe even not strenuous work on the job, that it is important to maybe put in the what do they call those? The defibrillators. That in case of emergency, open the case and use it with proper training. But you're finding more companies are doing that, putting that kind of technology in their offices.
Exactly. A defibrillator being available in certain facilities is extremely important. We advocate for defibrillators, automated defibrillators being available in all public scenarios, places where those can certainly save lives. But particularly talking about the topic of defibrillator, that's a very good topic because those who have already an internal defibrillator placed in their heart, the conversation changes completely for those when it comes to heavy lifting and heavy work, because we typically do not recommend that for those people. They do need to run it by their cardiologist to see what their functional capacity is, how much they're capable of doing, and is it safe for them to do such heavy lifting.
Okay, very good. So say somebody experiences a cardiac event, heart attack, or something that would require them maybe to be out of work for a while or sit on the sidelines. In the event of that, do you recommend that, say, motor carriers or whatever company or industry just kind of gradually have that individual slowly return to work on a gradual basis, not all of a sudden, all at once, jump in and get going?
I do, yes, absolutely. I would recommend them to slowly introduce, the kind of workload that they're going to be doing to make sure that they can actually handle it. So, yeah, those things are going to be very important.
Okay, and the defibrillator, not easy to say. What happens? Does that device actually stop the heart to allow for somebody's own natural electric rhythm to catch back up or start them?
So the purpose for a defibrillator is actually in the event a patient has a cardiac arrest, which means that the patient's heart has already stopped and they're no longer breathing and they have collapsed. That's the time when the defibrillator will kick in. They will shock the heart and will restart the heart, and it's very life-saving in those who need it.
Okay, very good. And the defibrillator, will it actually talk somebody through the way to do this? I've heard stories that there might be a computer program involved where it says place the paddles here, and then clear. Does that walk people through this electronically? With a voice? Yes.
So there are two different types of defibrillators. There's one that's an external defibrillator. That's the one that if somebody collapses and somebody who is standing by, a bystander who's watching, they can use that defibrillator to bring that person back. And yes, in those defibrillators, the automated ones, they usually do have instructions where they say, place the pads, and I don't think they say where to place the pads. That's why some amount of training is necessary, CPR, for example, basic training that we encourage everybody to do. But they do tell you to clear, and so a couple of things the defibrillator will do. Number one, it'll tell you that it is a shockable rhythm. So it'll instruct you whether a shock is needed or not. And then it'll tell you clear, and you'll shock the patient, basically. But until that pad is placed properly, the defibrillator is not able to analyze that and not able to give that instruction. So to answer your question, how to place that pad, it does not give you that instruction. You kind of have to know that one.
Okay, very good. And this is going to get down to the importance of training. Say, at a truck stop or an office, that somebody be trained and certified, maybe 2 or 3 individuals, almost like a team, in other words, that somebody experiencing cardiac arrest at the trucking company, whatever company they're in, that 2 or 3 individuals that work there can respond to this, right? And then it's they kick into gear, hopefully with the ultimate outcome of saving that person's life. Would you recommend folks be certified for that, maybe on the job?
I do, yes. Basic life support, which trains you how to do CPR and administer shocks and things like that. Anybody can be trained in that, and certainly in all fields I recommend, and definitely in the trucking industry I would recommend that.
All right, very good. All right, doctor, let's do this commercial time. And drivers, Dr. Fahmi Farah is on, one of North America's most recognizable names in the cardiology arena. Questions, comments for her. Would love to get you on board. Think about this. When is the last time that you were in your trucking company office? You probably maybe walked right by this, but I'll bet you your company's got these defibrillators on the wall. Maybe it's in a break room. Maybe it's in a cafeteria. Maybe it's in an area where there's several offices out there. And have you noticed that? Or are you seeing more of those defibrillators in the office when you go in? Wouldn't be a bad idea, like Dr. Farah was stating, learn CPR. In case you run across somebody that does need medical attention, you can certainly step right in and maybe save a life. We're going to be back in a minute. Stay tuned. I do want to share a story with you. This was a number of years ago that a friend of mine, a dear loved one of mine, was having, we were having a conversation. And right in the middle of the conversation, my friend collapsed right in front of me, went into sudden cardiac arrest. And I'm trained and certified in CPR. And this person was having some extreme breathing difficulties, suffering from COPD and some other items going on. And I was able to perform CPR on this person and called 911. I was able to keep my composure while doing this. And this is a loved one. It's very difficult to perform CPR on somebody you love. I mean, the emotion just overtakes you. But long story short, that it was performed successfully, and I was able to bring that person back. That person stopped breathing, and paramedics in the community I live in were here probably within 4 to 5 minutes. And, you know, Dr. Farah, looking at that, the importance of knowing CPR, knowing when to jump in, and keeping your composure can really, really make a big difference. That person has since passed away, but, you know, the situation was got to take charge and then go into action. Do you find that maybe many people, when they see somebody going into cardiac arrest, they freeze up, which is understandable? How do you see that? What do you say?
Oh, yes. Learning and knowing how to CPR and being able to administer on time is so crucial to saving that life. And it's not just saving the life. It's also like if that person survives, minimizing the neurological damage that can be done. Because when somebody goes into cardiac arrest, they're, you know, the heart, of course, completely stops, and so the circulatory system stops. And so brain doesn't get any more blood flow. So you know, they can have severe brain damage. And so the quickest way to, you know, like that, faster the CPR administered, the less likelihood of that happening. That was very important and impressive what you did.
Well, and I'll tell you, it really did teach me a number of lessons about the importance of medical checkups and wellness and things like that. In fact, one of the members of the hospital staff came out and said, congratulations, you really did a good job. You ought to go into medicine. I'm like, okay. But man, it was just amazing to see the technology, because this person indeed was brought back, and that person experienced 5 more years of a very robust life. So learn it for your family, right? Learn CPR for your family, for your friends. You never know when you might need that. It may come at any moment. Really got to understand it, and I know that a number of trucking companies offer CPR training. Drivers, you may be able to do it online. I would recommend maybe try to do it in person out there because the more hands-on, the better. Doctor, thank you very much for joining us on the show. And again, just to reiterate, learn CPR. Can folks maybe go to your website and learn more how to do that? Where can I go to find you? Good question.
Yes, you can find me at www.drfahmifarah.com. You can also find me on Instagram and X at Fahmi J. Farah.
Okay. Doctor, thank you very much for joining me on the program. And we'll do it again next week. That's Dr. Fahmi Farah.